Joining me today is Dr. Eric Franz. He is a Chief Medical Officer at the Colorado Department of Public Health and Environment. You've seen him before here in this segment. Dr. Franz, it's a pleasure seeing you once again.
Thank you, and you as well. Good morning.
Good morning. Dr. Franz, how many people are vaccinated so far locally? Because the numbers of Omicron are so staggering, so crazy.
Well, it's a good question because of asking what is vaccinated, right? Because of course we had the original recommendation for 2 shots, and now to be up to date, if you have the mRNA vaccine, you should get 3 shots. And so just over half of eligible Coloradans have gotten all 3 of their shots and are considered up to date. And so there's opportunities for improving that number. In children, it's about 1/3 of the 5 to 11-year-old children who are up to date, and they've gotten their 2 shots at this point. So, of course, the numbers are higher if you just say how many people got the original 2, and it varies by age. So 9 out of 10 people 65 and older got at least those first 2 doses, which is good. Getting all 3 and being up to date, though, really provides you with the best protection. And so all of us still should be getting our booster, getting our 3rd shot, if you would. I would say what we've seen of late is that people who have had all 3 shots and are up to date are much less likely to be in the hospital. So if you are unvaccinated, you're 46 times more likely to be hospitalized than someone who's up to date with all 3 shots. So if you've gotten only 2, go get your 3rd. If you haven't gotten any, I really recommend you get it because you're at much higher risk of being hospitalized.
That's quite a big figure that you share in there with us, Doctor. 46 times more higher your propensity to get hospitalized. And talking about that, the CDC announced recently, January 6th to be exact, that all teenagers 12 through 17 years old should get a booster after 5 months of their 2nd shot. Is that going to be just for the Pfizer recipients, or eventually you think Moderna is going to do something similar?
Yes, it will be for Moderna and Pfizer. And so we just recognize that the 5 to 15s need to get boosted just like the adults are. And so being up to date will change over time as we understand more about who's eligible. And so there'll be a time in the near future, I think, where the children under age 5 will be able to get vaccinated as well. And so that will change who can be vaccinated, what it means to be up to date as well. So these things do change over time, and that's normal because our science progresses. We learn more things. We figure out what's the best way to protect everybody. And so expect these things to change over time. Pay attention, and when it's your turn to get vaccinated or to get another dose, please be sure to do so.
Speaking of science progressing and the virus being very organic, so to speak, and very changing very fast, there were some changes when it comes to the masks as well. 1 mask, 2 masks, 3 masks, K95 surgical masks. There were some changes as of this morning about that. We have some good news to deliver to the Colorado residents, right?
Yes, that's right. I mean, we've been making masks available now and distributing them out to a variety of places where people in Colorado can go pick up masks. And we've always known that with a better quality mask, you'll get more protection. And the best quality mask is called an N95. We actually call it a respirator rather than a mask. It's also called the KN95. And they just do better at filtering out the virus. And so they're not expensive. And those are what we're providing for free at the various sites. You can pick them up. Of course, you can always order your own online. There's very high quality KN95 masks or N95 masks. And why not wear the best if you're trying to protect yourselves? And so, whereas there may be some value with the cloth mask, and then maybe a little bit better from the surgical mask, and now the best we know with the N95 mask, it makes sense that we should wear the N95 when we're in the grocery store, if we go out to a movie, if we're in a public space with a lot of people around us. Wearing the N95 will give you the most protection. Also, of course, remember the new variant, Omicron, is very, very easy to spread compared to the earlier versions. And so that's just one more reason why wearing the best protection, the N95 mask, is the way to go. So if you need a mask, if you want an N95 mask, we have them for you for free. Go to our website to see where there's a site near you. We had over 65 locations earlier this week. We're adding another 30. I think we've distributed over 500,000 this week to those sites. And so go and find out on our web where there's a place close to you, a library, a fire station, might be another site, and go out and grab some masks for you and your family.
Doctor, I noticed as well that this country and this state never cease to amaze me. This is fantastic that we have in-home tests right now being available to all the population in the USA to be able to request those. We get 4 per family, 4 per household, and now these free KN95 masks, as you just described. But yet we are still seeing so many cases. And I wonder if you feel like all the at-home tests are being officially reported or not, because we see so many cases of Omicron repeatedly being reported, and it doesn't seem to cease. It doesn't seem to come to an end, right? We keep hearing about hospitalizations numbers going on the rise side, and we feel like, what's going on? We're getting more people vaccinated. We're still wearing the masks, yet we see all these tests, yet we see all these new free masks, and we still see numbers continually on the rise. And that seemed to be the forecast for the next few weeks, at least, right?
Well, that's right. I mean, we're still in the middle of our Omicron surge. And so this is a variant of COVID that is very infectious. And as such, it will infect people in our population very quickly. And then there won't be anybody to infect, so it will disappear, hopefully quickly as well. And we've come up with Omicron, and it looks like we peaked earlier in January, and we're starting to come down with Omicron. Our hospitalizations have stopped going up, they've flattened, and our expectation is that this week they too will start to go down. If you're unvaccinated, you're still at risk for hospitalization. And when I speak to my colleagues who work in the hospitals and take care of people in the hospital, I ask, who are these people that are so seriously ill with Omicron that they end up in the hospital? And they say they are, first and foremost, people who have not been vaccinated. They are people who are overweight and who are obese. They are people who have diabetes or heart disease. And so the patients who are most ill and in the hospital are unvaccinated, overweight, obese, diabetes, heart disease. And so if that sounds like you or a family member, then please go get vaccinated, because you are the group that ends up in the hospital today. And we will have people hospitalized over the next month because of Omicron. And even with it coming down, it's so widespread that there will be a lot of hospitalizations. Now, it sounds maybe when I say that, why get vaccinated? Because it's still spreading. But recognize that if you're vaccinated, you're much, much less likely to be that hospitalized person or in the intensive care unit. Mm-hmm. So even though you might get a case, it will likely be mild and you won't end up in the hospital. And nobody wants to be in the hospital. Nobody wants to be that seriously ill person. And so it's important that you get your vaccine. So even if you get it, it will be a milder case for you. So yes, things are coming down with Omicron. There's a lot of home testing, which is great. Our state of Colorado was the first to send people home tests, and we've been doing it for months. And now the nation is making it available for everybody as well. It can be very helpful to be able to just check yourself when you have symptoms to see if indeed it is it is COVID. So I recommend you get online with the national system to get free COVID home tests. And I think we still have some as well, so you can order them for us as well.
That's fantastic news. Thank you, doctor, for the reminder. I was recently part of a press conference, and I was amazed by the very fine distinction between patients at hospitals being hospitalized due to COVID, with COVID, versus being at the hospital due to COVID. That very fine distinction, with COVID or due to COVID. Could you explain that a little bit more for the audience, please?
Well, from the beginning, we pay most attention to how many people in the hospital, because we know that when we look at the number of cases, to be a case, you have to be tested, and not everybody's being tested. So there's a certain inaccuracy in looking at the cases alone. But to be hospitalized, we've always thought, well, if you're hospitalized with COVID, then you're sick and you needed to be. So that's probably an accurate measurement of what's happening. Today, however, it's changed a bit because, again, Omicron is very common and many people are not very ill from Omicron. So if next Tuesday I'm scheduled to get surgery for a lump in the breast, or I have a gallbladder that needs to come out, I go to the hospital on that Tuesday morning for my scheduled procedure, and I'm tested for COVID. And surprise, surprise, I have COVID. I didn't have any symptoms, but because Omicron is so common, people are turning up and being found out to have COVID at the time that they're being admitted for a procedure. Or maybe it's a serious thing. Maybe they have a serious injury and they're admitted, and they also found to have COVID. So COVID is more common, and you can be hospitalized with COVID, or you can be hospitalized because of COVID. So some person comes in and they're coughing and they have fevers and their lungs aren't working and it's COVID, and you're like, you're hospitalized due to your COVID. And then there's this other group of people who are hospitalized for another reason, but it turns out they have COVID, so they're hospitalized with COVID. And when you combine those two numbers together, that's the total number of people who are hospitalized and have COVID at the same time. And we have estimates that maybe 4 of every 10 people who are hospitalized and have COVID are actually not sick from their COVID. So 4 of 10 are not sick. They're just hospitalized with it. And that impacts the way we look at our overall numbers, because it means all these people in the hospital with COVID, not all of them are there because they're sick from COVID. And so I have to moderate how I look at how things are going with the pandemic because of that issue that we have today. Something we didn't see 6 months ago with the earlier versions, but now is something we have to take into consideration when we look at the hospitalization rates with COVID.
Mm-hmm. Legend has it, as my 6-year-old daughter would say, that at some point all of us are going to get COVID. Do you think that's the case, doctor?
I think it's true that many of us will get COVID. Those of us who've been vaccinated and fully up to date, we may get it without any symptoms, and we might get it mild and we may not even know we have it. So a very large proportion of us all will get it ultimately. The question always, though, is how do I best protect myself so I don't end up in the hospital? And even knowing that everybody's going to get it, it's still important to be vaccinated so that we don't end up in the hospital.
This is true. Why some folks don't get COVID?
I don't know that we have enough science and understanding yet about who doesn't get it. My son's girlfriend is a nurse, and I asked her if she's been sick in the last 2 years. She takes care of patients in the ICU, and she's never gotten it. And she says, I may have gotten it and I don't know it. I feel like I'm probably protected at this point. Of course, she's gotten all of the shots as well. And so she isn't too concerned that she's going to get seriously ill. And I think if you're young and you've gotten all your vaccines, you shouldn't be worried that you're going to end up in the hospital unless you have some serious medical condition that puts you at higher risk.
Let's don't jinx it for your nurse friend. Doctor, do we know what laboratory will be the one offering the vaccine for kids 2 to 5 in the US? Do we have any news about
I
that?
think it's the Pfizer vaccine again, and it's likely to be in the next month or so that we might start hearing more about the children under 5 being vaccinated. But we haven't heard much details just yet, but it should be soon.
That's great news.
Yeah.
I'm going to move you now to monoclonal antibody therapy. Is it working against Omicron or not?
That's a good question. So there are a number of treatments for people who are now sick with COVID. We've had one group of treatments that we call monoclonal antibodies. They first were available in November of 2020, and they would reduce your chance of being hospitalized by 70 to 80% if you got this IV infusion within 10 days of starting your symptoms. That changed as of Omicron. And because the Omicron variant has evolved and looks different, these antibody therapies are not a good match. There are 4 different monoclonal antibody therapies that have been made available. And 2 of them, which we used quite a bit last year because they worked against the Delta variant and the Alpha variant, 2 of them do not work with Omicron, and 2 of them seem to work with Omicron. Unfortunately, the ones that work with Omicron, we don't have much of a supply in the United States. So we just get a few hundred doses in the state of Colorado sent to us by the federal government. And then we send it out to hospitals to use on their most highest risk patients. So the monoclonal antibodies, unfortunately, some of them don't work for the Omicron. Some of them do, but those are the ones that we don't have many doses coming. Then there's this whole other group of medicines for treating people that are given mostly by mouth, a pill, and one of them works very well. The other one maybe a little lower in how well it works. And those are encouraging. The problem again is supply. The number of doses we get are in the few hundreds every other week, and the federal government has sent some out, but they've been slow in mailing them to us. And so we don't really expect that those kinds of treatments will be in adequate supply until this summer. So while we have treatments, there are very few of them coming in. We've used some of them specifically for people who have cancer, for people who have immune problems. We've used them for those essentially who are at most risk of being hospitalized. And I would say that includes people who are not vaccinated. You know, it may anger people who've been vaccinating that our first priority for these treatments are people who've chosen not to be vaccinated. And the reason is because, again, those are the people who are going to end up in the hospital. And if they're in a hospital bed, that may be a bed that's not available to me if I had a heart attack tomorrow, even if I'm vaccinated. So I would like them to be vaccinated, of course, but if they aren't vaccinated, I want to keep them out of the hospital. And so with these few treatments we have, we're going to use them for the unvaccinated older people over 65 so that we can keep that hospital bed open in case I need it for something, or other vaccinated and unvaccinated people need it for some acute reason. So few doses, mostly going to the unvaccinated who are at highest risk for being hospitalized.
Omicron seems to be so strong that I was reading recently that some doctors in Tel Aviv, Israel, have tested and have done a 4th booster, and yet they still got Omicron, and they still didn't seem to be repelling, so to speak, the virus in their immune systems. That's how strong this virus is and this variant is. Doctor, you talk about angering people, and I think being somehow a community outreach person myself, I noticed that the morale in the society is going really low. Some people are feeling like, you know what, I got the first dose, the second dose, I get the booster, I wear my mask, I bought the new mask, I'm doing my at-home test, and yet I got COVID second time, third time, fourth time. People are feeling like, when is this going to be over? Do we have any word of hope for them?
Yes, well, you're right. It can be very frustrating for us to do everything we can and we still get COVID. And of course, the good news is when people get it, they may be sick, and let's not downplay it. It is an illness that for some, even after being vaccinated, means you have fevers, you have low energy, it may last for 3 or 4 days and you feel pretty sick, but it's kind of like a flu in that. And the good news, because you've been doing everything right and you've gotten vaccinated, it's very unlikely that you'll end up in the hospital. So that's just what it means to live in a world now with this virus as part of it. We should expect it will continue in the future. Unfortunately, we don't really have a good sense of what's coming next. So on the one hand, can we be optimistic that now Omicron is on the way down, and that maybe by March it will come quite down and we'll be back to a more normal, new normal life? On the other hand, will there be a new variant that pops up somewhere in the world between now and March? And will it, and then what will it look like for that new variant? Now that Omicron's infected a lot of people, maybe the new variant won't have much impact on us. Or maybe this COVID virus has changed in a new way and it's dangerous. And even if you've been sick with Omicron, there's no way to predict that today other than to think that it's not going away. It's going to be in the population. Our hope is that because Omicron has come through, infected a lot of people have been vaccinated, our base level of protection is now high in the population, and whatever comes through next maybe won't be too serious. But we won't really know until we get there. So in the meantime, continue to do the right things about wearing a mask in public places so that you're protecting yourself and others, getting vaccinated, and try to prepare for getting to more of a normal life. It may not be until end of February that we feel confident in that, but hopefully we can find ourselves in a new future that works well for everybody.
I remember speaking in March 2019 with Dr. Andres Henao from Anschutz, and he was telling me, Virginia, I asked him, Doctor, how long do you think we have to brace ourselves and hold tight because this pandemic is going to be among us? And he said, at least 2 years. The pandemic is going to turn 2 years old, right, in a few months. Do you think the virus is ever going to become dormant, or we're going to be facing an endemic situation, Dr. Franz?
Yeah, I don't think there's any reason to think it will ever be dormant. That's like asking, do you think the flu virus will ever be dormant? Do you think the common cold will be dormant? Remember, many common colds are caused by the same family of viruses. Coronaviruses cause the common cold. So here we have a new coronavirus called COVID-19 that entered the human population sometime in 2019, and it's going to be here. It's here to stay. And so now the question is, what will it look like going forward? And that's where none of us really have an accurate crystal ball, but we can say it's not going anywhere. It's not going to disappear. Maybe the best case scenario is that it becomes another common cold virus, and we see it passing around, but it doesn't cause serious illness. The worst case scenario is that it continues to change and we're chasing after it with a new developed vaccine that's better matched. And I don't know which path the future will look like.
We hope it's a brighter one.
Yes.
Dr.
Yes.
Francis, it's always such a pleasure speaking with you. Thank you so much for your time.
You're welcome. Thank you, Virginia.
Of course.